So now I'm going to invite Dr. Guo Song. I mentioned about him just now. He's a close colleague of mine at the National Addictions Management Service at IMH. All right, so we work very closely together, helping people with various kind of addictions and especially gambling disorders. So I'm going to get him up here to tell you more about the management of gambling disorders with some of the recommendations from the CBG. Okay, right, Guo Song.
Thank you, Dr. Lee. And first of all, I would like to introduce myself so that actually I'm from China. I've been working in Singapore for 7 years. And upon arriving to Singapore, I've been working in the area for addiction disorder. So all my education actually were obtained in China, so in Peking University. So that today that my talk will cover two topics. One is the general principle in treatment for gambling addiction, and the other is treatment for special populations. Actually, to compile this guideline that our team that worked for almost 2 years, and when we look at the paper, that although we eventually have compiled the guideline, but there is some limitations that while we were reviewing the papers that we found, that most of the paper, and we found that it's very, how can I say that the research is not like other studies, and because that the gambling addiction is quite new. So most of the study, either very short period of time or no control group. So that anyway that we try our best to provide that evidence in order to guide our treatment for gambling addiction. So first, I'd like to talk about the management principle. That most of the people will ask whether treatment is effective for gambling addiction or not. That very often that I heard from our patient families that they believe that gambling is their own choice, so that based on the study and our clinical experience, and the treatment does work, and also that the gambling addicts can respond well to treatment as long as we provide the proper treatment for our patient and meet their needs. And the second question is, who should be helped, or who should be in the treatment? So actually, first of all, of course, is the patient. Is the patient with pathological gambling, and also that is the treatment is also suitable for the patient that they are in the stage of problem gambling. And the problem gambling is that I believe that in this and before that the talk have already included this topic. So problem gambling is the level that haven't reached the severity as pathological gambling. And also that the family members also need help and sometimes need treatment. And because we know that the addiction is a family disorder, so all family members and the significant others are impacted by the gambling behavior. So when we talk about the treatment, that when we review the articles or previous studies is that very often that we saw this, that it's said that no single, so far that we understand, no single treatment model is better than the other. That means although it's a psychological psychotherapy or social intervention or medications, no single that models is better than others. And also that the PG is a multifaceted condition that requires a multi-model treatment. It includes pharmacological interventions, psychological interventions, and practical management. I will talk in detail later. And to implement these principles, it needs a multidisciplinary team that to implement this, provide this treatment. And this team consists of psychiatrists, addiction counselors, and also allied health professionals, including social workers, psychologists, and so on, and a nurse, and sometimes OT. And also while we're providing the treatment to the patient, that they have to make sure that the treatment plan is individualized to meet the patient's special needs, and also that the treatment plan should be made according to patient stage in changes. So that I believe this morning we mentioned about the stage of change. So different stages that the patient have different need, and also have the special strategy to deal with the patient. And also the type of the services including inpatient treatment, outpatient, and the psychiatric services. And also that in this guideline we didn't mention about the telephone counseling, and also that actually in our treatment center we also provide the telephone counseling. And regarding to the treatment goal, that the ultimate goal, of course, should be the abstinence, the total abstinence. But the reduction in the gambling behavior sometimes also that the temporary target is the interim target for treatment. And about the treatment concept, that sometimes that the patient or family will ask us that the patient or my family members, whether, although right now they are in pathological gambling, whether they can go back to social gambling, or can patient go backward from severe type of gambling to milder type, means that the problem gambling. So that this is always the topic to debate. But based on my experience, that it is very hard for patients who develop pathological gambling to go back to so-called social gambling or normal gambling. And also according to DSM-4, if somebody developed addiction or dependence, it's impossible, or that very, very seldom case can go back to abuse. Means that to go back to the milder stage. So once somebody developed addiction, so they have to work with it almost the whole life. And about the pharmacological intervention, that so far there's no medication approved by FDA for pathological gambling. However, there are some studies, even some double-blind study, shows that some medication are effects for pathological gambling.